It's National Smile Month. So obviously we should be very happy with respect to our dental hygiene and all sorts of other marvelous things with respect to National Smile Month, etc. But inevitably, there's certain sort of interesting facts that have come out with respect to obviously the 12 to 14 months we've just been through in terms of the pandemic, and how, of course, the pandemic has actually put our smiles up front and centre. And to talk us through some of the fascinating findings of this, we're delighted to welcome the president of the Oral Health Foundation. That's the wonderful Dr. Ben Atkins. How are you, Ben?
Very well, thank you, Alex. How are you?
Splendid. And fascinated by this particular survey, which suggests that men are actually more self-conscious about our smiles than women. I mean, is that something that surprised you? I thought we were supposed to, as men, we just thought, what the hey, we'll just make a smile. Or is it just a case of when we smile, there is always that possibility that it comes across as just a tad creepy, shall we say?
Ooh. Do you know what? No, I don't think it does. I think the key thing is men, we traditionally don't really look after ourselves. We don't. We leave things to the last minute. We're far too busy and alpha and all this sort of stuff. And what we're finding now is because we've been doing exactly what we're doing, we're looking at Zoom, we're thinking, oh, look at my teeth just up there. I'm pointing to the screen, by the way. It doesn't really work very well on radio. But actually going through all that, it makes such a difference when men suddenly start thinking they've not looked at them before. They haven't. They brush their teeth often, not even using the mirror. They'll just be
we've got other things to do. We can't be doing that vanity side of things. It's a quick brush and away we go.
But they've also men have got worse teeth than women, without question, and that's what we find in practice. That women will come in, they've brought the children and etc. I know that's a sexist view, but it's what's historically been the case. Men bring their children more than they ever have done, are involved in the journey. However, historically, it was the women's job. So they benefited from going to the dentist constantly. So I am not surprised that the research done by the Oral Health Foundation and Invisalign has shown that men have got worse teeth, or think that they've got aesthetically worse teeth.
And of course, British men far worse than American men, but that's a different line entirely, perhaps.
We could go down that road, but the research actually shows that Americans have got worse than men, but the British. There we go. That's a different conversation now.
Absolutely. Now, again, working on this whole system, I must admit that rather like a number of other folk, the pandemic has meant that my usual annual checkup has now become a biannual checkup. In other words, it'll be about 17 months since I last had a checkup with respect to that. And obviously, it is important that we still keep our appointments for our regular checkups.
Really important, and something I'm really proud of is the fact that my profession has pretty much kept open all the way through this pandemic, except maybe a couple of weeks at the beginning when we were supporting the nation's push and all that sort of thing. But for me, it's actually speaking to your dentist, your dental clinical team, and saying, when do you want me? Because some people, I haven't got a problem not seeing you for 2 years. That isn't a problem. But some people I want to see every 2 weeks, so that's a different conversation. But for me, it's understanding where you are. So a little phone call to your dental practice and visit those practices as often as we deem necessary. The other side of that is more the aesthetical side. Look, you want to pop in for a clean. You want to maybe start looking at Zoom Boom Smile with the Invisalign malarkey. And I think it's understanding from a clinical point of view what my patients need and what their patients want. There's two different areas there. So it's actually working with your practice to say, look, when can I come in? What's the safest way for me to come in? Because dental practices are phenomenally safe. We've always used PPEs for 20, 30 years. It's nothing new to practice. We just had to put a few more processes in, which are scaling back a little bit now, and dental practices are open. We have been for the past the whole second lockdown, which actually makes me smile because patients have been popping in and saying, you're the first people I've seen for 6 months. I'm really excited about coming to the dentist, which is a first. Which is a first. That's good.
Well, it sort of means that it's a reset, and it's part of the pandemic bonus, perhaps. Now, intriguing that face masks that clearly we're all used to, I was using one this morning, actually, when I was doing a little bit of external work, etc., is something that it's considered the norm, but despite the fact that it's all in the eyes, the smiles in the eyes, clearly that's not the case. And many folk have actually found it quite difficult to form connections because of face masks. I mean, has that been something, again, that you were surprised at, or is it a case of, well, naturally?
I'm not surprised because that obviously is my world to smile. Now, I hate to break a trade secret, the fact that I do look at people's teeth when I meet them, but more people are doing that now. If you actually go when you're walking down a street, you'll see people in masks, and they might actually be a friend, but you're talking on the phone. Historically, you'd smile, you'd wave at them, but now you almost keep your eyes down, you don't talk to them. And for me, that is why people are suddenly thinking, you know what, I've got to get my smile sorted out. When this mask comes off, the great unveil, and we're back to normal. And when people are smiling, it's going to be an amazing journey. And when I can look across the street or across a bookshop and smile at someone, that it's reassuring, and people need to be able to smile. And that's what Smile Month is all about. So Smile Month is here between the 17th of May and the 17th of June, celebrating something that we can control. We can control the way we smile, the way we look after our teeth, and it's getting back to that, I look after myself. And it's a fight I have every day with my children. So, yes.
Now, I think we've already addressed this, but in many ways, it's worth noting that it is important to get in touch with your professional dentist as opposed to simply looking for advice from influencers on social media. That could only end in tears, surely, Ben, if you're going to use the social media route for advice on dental healthcare.
I think social media it can be a good area if you watch the right people, but you must be influenced by the right people, not just someone on TikTok doing this or whatever it is.
You've got the door, you've got the piece of string, you attach it to the tooth. No, don't go there. It's not good at all.
No, you wouldn't have done that historically, so why are you doing it now? Teeth are there to last your whole life. They are there for all this sort of stuff. And we, as the Oral Health Foundation, working with Invisalign, there is so much information out there on the internet from good sources. If you look at the Oral Health Foundation website, it's called dentalhealth.org, or if you're thinking of straightening your teeth, look at the Safe Braces campaign website, which is safebraces.org, which is working with the British Orthodontic Society. And there's also the Invisalign website. But looking from the correct place and speaking to your dentist, speak to people you actually trust and know, not just are familiar with. You wouldn't do that with anything else.
Absolutely. So, Ben, any major tips that you actually provide, other than obviously brush in the morning, brush in the evening, brush after meals, keep on brushing? And I'm pleased to say, again, I think we've discussed this before, I was never a fan of the floss. I have to hold my hand up and say, I'm not a keen flosser. I always thought flossing, not great. Brushing, yes, no problems. Flossing, less so.
Well, do you know what? That's really interesting, because if you brush in between your teeth, you really reduce the amount of decay you get. So if you think about, you can't floss, that's fine. Think about another method that you're going to do that, and you suddenly will find the one to you. So when you go into your dentist or your therapist, your hygienist, your oral hygienist, ask them to give you options. Floss is not the only way. Personally, I use little brushes, and that I actually use it every single day, once in the morning, once in the evening, as well as my brushing regime. So brush your teeth twice a day with an adult fluoride toothpaste, once in the morning and once in the evening.
And finally, Ben, we've already mentioned one web address or a couple of web addresses. Where would you actually point people to actually find out more about National Smile Month and so on in terms of dental healthcare and keeping care of your smile is what I'm trying to say.
For me, visit www.dentalhealth.org. That's the Oral Health Foundation's website. If you also want further information on Safe Braces, safebrace.org, and there's also the Invisalign website.
As ever, an absolute delight, Ben. Two final questions. They are inevitable. It's part of our social media, but it's the first time we've actually seen each other via Zoom, so that's nice. Have you had a reasonably interesting Zoomer with us on the program today, first of all?
Absolutely fantastic. I love it. We've actually seen each other for the first time rather than just over a voice, which is wonderful.
Well, there you go. I've even had John Wayne in the background. That's another story, another tale entirely. But can we then look forward to featuring you again in the not-too-distant future? Will you be kind enough to return sometime?
Anytime you want me, I'm there.
Dr. Ben Atkins, President of the Oral Health Foundation. Huge thanks indeed. And inevitably, we have to say, Happy National Smile Month.
Keep smiling.